Hello and welcome to today's video. Today we're going to discuss about cold sores, which is also known as fever blisters. Now this affects about 30% of the population and it's a common viral infection. It's caused by a virus known as the herpes simplex virus. Usually it is seen at the junction of the lips, but it can also spread to other areas such as the eyes or even fingers. So the big question is, can it heal completely? Unfortunately, this virus stays with you for life. The virus lies dormant in the nerve ganglion and is triggered by factors such as stress, trauma, sunlight, or certain other illnesses. So, therefore, it tends to recur whenever these factors are favorable. Cold sores are highly infectious and can easily spread. They mainly spread through close contact, that is skin to skin contact, as well as saliva, because saliva is highly infectious. Now, this can also be seen in vaginal secretion, so mothers can easily pass it on to newborns because of vaginal secretions. So, how do you know that you have a cold sore? Usually, it starts with a tingling or itching sensation. There might also be slight redness. Within 48 hours, there is a small fluid filled blister. These blisters eventually burst and then they crust over into a scab. So, when is it highly infectious? So, it is contagious from the time you feel the first tingling sensation till the lesion has completely healed. So let's look at how to prevent cold sores from spreading. Avoid contact with the infected person. Do not touch or pick at cold sore lesions, especially when they are crusting. Do not share utensils, spoons, cups, toiletries, makeup sets, etc. Avoid close contact with loved ones if you have an active lesion. So let's look at management of cold sores. The first thing you could try is applying an antiviral cream such as acyclovir 5%, but this needs to be done at the early stage of infection. The topical cream needs to be applied when you have the early tingling feeling and not after the blister bursts or scab occurs. The second thing that you could do is use a chlorhexidine mouthwash. Now, these are recommended to compensate for the difficulty in carrying out a thorough oral hygiene. Usually, chlorhexidine mouthwashes are available in dark colored bottles. The third thing to do is to change your toothbrush, as the toothbrush can harbor the virus. Number 4, you could try applying aloe vera gel. This provides symptomatic relief. So, if you've got the plant, break off a small piece of the leaf and apply the fleshy portion onto the lesion. Number 5 is you could use ghee or clarified butter for relief. Now, when to use this? It's best to let the cold sore dry out to the point where it hurts no more and then apply ghee to minimize splitting and prevent bleeding. Number 6 is to get ample rest and drink plenty of fluid. Now, this is important so that the area heals fast and heals well. Remember, do not pick cold sores as this increases the chance of it spreading to other areas. Usually, cold sores begin to heal in 7 to 10 days' time and they usually heal without any scarring. Note, the virus can confine to saliva for almost a month after the start of disease. So it's important to understand the trigger factors, find what management option suits you, and make sure that you don't spread the virus. Many dental practices will refuse to see you if you have an active cold sore lesion, so it's best to postpone your routine dental appointment till the area heals to avoid any disappointment. Hope you found this video useful. Thanks for watching and we'll see you shortly in the next video.